Hello guys, first of all I want to thank you all for your support and comment on the first video I uploaded. Thank you very much guys, I love you all. And if you are new here, welcome to Quinty's World, where I talk about health, personal growth and development, pharmacy school experiences and trivial female related health issues. To watch my previous and subsequent videos, click on the subscribe button and turn on your notifications so you get notified anytime I upload a new video. So today on the Ladies Corners episode, I'll be talking on a very common issue among female teenagers and women of childbearing age, and that is dysmenorrhea, menstrual cramps. The topic is untold truths about dysmenorrhea. So this issue I'll be talking about today is a very common one among female, and we've heard a lot of things about cramps. Some people say it doesn't have a known cause. Some say it's caused by eating too much sugar, and some people say it stops when you give birth to your first child. And we wonder which of those things are true. So in this video, I'll be telling you all you need to know about dysmenorrhea, menstrual cramps. That's a medical term for menstrual cramps. I'll be telling you the causes, the types based on the causes, and everything you need to know about dysmenorrhea. Stay tuned and keep watching. Alright, so as female of a teenage age, or as women of childbearing age, we've at one point in time experienced cramps, if not on a regular basis. And we wonder what causes this pain. Okay, so what is dysmenorrhea to start with? Dysmenorrhea is the medical term for menstrual cramps, like I said earlier, and it's the pain associated with menstruation. It's a pain that starts 2 or a day before menstruation starts, or even as menstruation starts, and it can last for typically 12 hours to 36 hours. And it includes pain in mild or severe pain in the lower abdomen, in the back or the thigh, and also it might include other features like other symptoms like vomiting, fatigue, diarrhea, headache, and even feeling nauseous. So you see, when you see some ladies experiencing a very severe cramps, you pity them a lot. It's not easy. The pain is unbearable. It's not easy to be a female at all. It's not easy. Female experience childbirth, childbirth pain, and even menstrual cramps. It's not easy. So menstrual cramps, the severity varies from person to person. It's mild in some people and it's very severe in some people. So let's see the causes of cramps. What is responsible for menstrual cramps in the first place? So based on the causes, we have two types of dysmenorrhea, two types of menstrual cramps. That's the primary dysmenorrhea and the secondary dysmenorrhea. So the primary dysmenorrhea is caused due to natural sources. In fact, this is the most common type of cramps most people experience, and it's due to a natural chemical produced in the body called prostaglandins. So what do prostaglandins do in the body? Prostaglandins are secreted in the uterine lining, that is the lining of the uterus, that's the womb, and they are important mediators for ovulation, that's the release of egg into the fallopian tube, implantation of the fertilized ovum, and also placentation of fetus. So what happens is that when they are secreted in large quantities, especially in the first 2 days of menstruation, when the blood is just beginning to flow, they are secreted in high quantity, and once that happens, they cause the excessive contraction of the uterus, the womb. Womb is a muscular organ, so they cause the excessive contraction, such that the contractions press against nearby blood vessel. And when this happens, that cuts off the supply of oxygen to that region at that particular time. And in the absence of oxygen, that causes cramps or pain. The blood transports oxygen around the body. The blood is the one that is responsible for the circulation of oxygen around the body, and that is through the blood vessels. So when there is contraction of blood vessels, blood cannot move at that point in time, and that leads to the disruption, to the interruption in the supply of oxygen at that particular time to that particular region, and that leads to cramps, that leads to pain most people experience during cramps. So that's what happens during dysmenorrhea. Normally prostaglandins are associated with anything things that has to do with pregnancy. And if a woman is menstruating, that means she's not pregnant, and at that point in time they are not allowed to do their job, and they are being secreted in large quantity, so they can cause cramps. So this kind of dysmenorrhea, this kind of menstrual cramps can stop or reduce when you give birth to your first child, like most people say, and it can be managed. In my next video, I'll be talking about how to manage dysmenorrhea, most especially primary dysmenorrhea. So moving on to the second type, which is the secondary dysmenorrhea. This is an abnormal type of menstrual cramps, and it is due to a disorder or infection of the reproductive organ. In fact, if you don't experience cramps before, or maybe you don't experience severe cramps before, then all of a sudden you start experiencing it, then secondary dysmenorrhea might be responsible. You might be experiencing secondary dysmenorrhea. So what is the secondary dysmenorrhea? Like I said, is caused by the disorder of the reproductive organs, or the infection of the reproductive organ. And there are various things that causes it. There are various conditions that causes it. Let's talk about them. There are 8 in number. The first one I'm talking about is PID, what is known as pelvic inflammatory disease. This is a bacterial infection that starts in the uterus, that's the womb, and spread to other reproductive organ in females, and it can cause cramps. Also, we have fibroid. Yes, fibroid can cause cramps. Fibroid is a non-cancerous cell growth in or outside the uterus, the womb. Especially fibroid that grows on the wall of the uterus, they can cause cramps because they are adding to the weight of the uterus, and when the uterus contracts, it makes them contract such a way that they press against the blood vessels that are nearby, that are in that region, like the case of primary dysmenorrhea. So it causes cramps as well. So another cause of secondary dysmenorrhea is what we know as endometriosis. So what is endometriosis? Endometriosis is the growth of tissues outside the uterus. One of those series of events that leads to menstruation is the growth of tissues that linings the uterus, what we know as the endometrium. So what happens in endometriosis is that there is a growth of similar tissue, of that kind of tissue. This time around, it's not inside the uterus, it's not inside the womb, it's outside, or maybe near the fallopian tube. And what happens when there is menstruation, when menstruations occur, where there is the shedding off of the normal endometrium, there is also the shedding off of that other tissue that has grown outside the uterus. So the shedding off of that tissue might bring about scarring and even swelling of that place, of that particular area where it grew, where the tissue grows, and that can bring about pain. Even as the tissue is contracting, as during menstruation, the uterus too is contracting to release the lining of the uterus, to shed it off. So as the contraction is going on, there might be a mild pain at that point in time, and also as that other part of the tissue, other place where there's another tissue that has grown, is also contracting. It can also add to the normal mild pain, due to the mild pain the person is supposed to experience, and that can bring about severe cramps. Another case that causes secondary dysmenorrhea is adenomyosis. So this is seen in older women that have had children. It's common among women with children. And what is adenomyosis? This is the growth of the lining of the uterus into the muscle, into the wall of the uterus. So that brings about the enlargement of the uterus, and it can cause pain too. So another way to know if your cramps is due to either fibroid, adenomyosis, or endometriosis, is that there is usually heavy flow. There is usually menorrhagia. That's there's usually heavy flow accompanying. Like, you might not be the type that used to experience heavy flow before, but all of a sudden you start having heavy flow, and it's accompanied by serious cramps. So know that one of those three might be responsible. So another thing that can cause menstrual cramps is cervical stenosis. Another thing that can cause secondary dysmenorrhea. So what is cervical stenosis? It's a kind of defect that some females are born with, and that is the narrowing of the cervix. The cervix is the opening into the uterus to the vagina. Menstruation is the shedding off of the endometrium through the vagina. So the blood coming out from the uterus will pass through the cervix. The cervix is like the gate to the vagina from the uterus, from the womb. So if the place they are supposed to pass is narrow, and for the first 2 days where there is a heavy flow and the blood is coming out with a high force, so it will exert a high pressure on the narrow passage, and that can bring about pain. So another cause of secondary dysmenorrhea is Crohn's disease, what we know as enteritis or inflammatory bowel disease. This is the inflammation of the small intestine, and it's a gastrointestinal disorder. It's a gastrointestinal disease. Also, another cause is urinary disorder. Problems with the bladder and the urethra can cause menstrual cramps. Other cause of menstrual cramps can be due to problems with the reproductive organs like the fallopian tube, the ureterus, the or even the ovaries. So that is all about secondary dysmenorrhea. So if you feel that your cramps can be due to one of these causes, then you should see your gynecologist, because this problem can be managed, it can be cured, because it is not normal. It is not a normal cause of cramps. And for primary dysmenorrhea too, it can be managed. And in my subsequent videos, in my next video, I will talk about how to manage cramps and things to avoid while menstruating to avoid cramps. So if you enjoy watching this video, click on the subscribe button, comment in the comment section, and also like this video and share to your family and friends. Thank you all for watching. I'll see you in the next. Bye.